right now we're going to take a quick look at what is this New York health thing we're talking about. We know what the problems are. How do we go about fixing this? Because this is going to be a fight for health for all of us. Do you know anyone who struggles to pay medical bills? Well, we know a couple now. Mary Kay just told us about skipping medications and appointments and trying to budget things out. Do you feel like you have a say in our system? Doesn't sound like the folks in Penn Yan up until recently felt like they had very much say in the system. So these situations are happening all over the place, and we need to be aware of them and know how they're making us feel and put that stuff into words. Uninsurance may be at historic lows, but over 1 million people are still uninsured. What this graphic doesn't tell us is that insurance doesn't guarantee that people can afford the health care that they need. Also, a majority of the previously uninsured nationwide remain uninsured after the ACA. So since tomorrow is Valentine's Day, I think these insurance CEOs ought to be sending all of us some Valentines. While 62% of the bankruptcies filed are due to medical costs, the Aetna CEO is sitting up there with $27.9 million. The United Healthcare CEO is at $20 million a year, and Anthem CEO was at $13.5. I believe this is a couple years ago. As you can see, they are thanking us for paying our insurance premiums and reminding us that they sure do love our money. There is a better way. There's several different names for it. You can call it single-payer health care, universal publicly financed health care, or health care as a right. Let's look at how our current system is set up. This is a simplification, believe it or not, representing how payment and coverage happens and doesn't happen under the Affordable Care Act, which for all the good it's done, it hasn't changed the fundamental system that is already broken. About half of the Americans get their insurance through their employer or their family's employer. Others buy insurance directly from the marketplace. Elderly and disabled get theirs through Medicare. Low income gets Medicaid. There's the Children's Health Insurance Program, the VA, IHS, that's not shown here. The uninsured either pay out of pocket or find charity care or delay going to the doctors at all. Front and center here is the for-profit insurance companies, which administer many of these programs. The problem here is that the system is profit-driven. All the doctors here, are they going to be looking at what's best for the patient's health, or are they looking at the bottom line? Because profit tends to win out, right? Wasteful. All the billing and denials and appeals, all that unnecessary cost is more stuff we're paying for. It's fragmented. There are so many gaps that can fall through the system as it is today, and it's multi-tiered. Depending on your insurance, you will find that you have access to care in some places and not in others. In other words, it's separate and unequal, which makes it unjust. It's expensive. People who earn income fund their own insurance plan. They have to pay their premiums, their deductibles, their co-pays, and all of these costs are increasing very quickly. Plus, we have the publicly funded programs that they're also paying out of their taxes. So, there is a better way. How does single-payer health care work? First, businesses and residents pay affordable premiums to the government. Just in this step, 95% of households are going to pay less than they're paying for insurance now. Second of all, the government funds a public health insurance plan that reimburses doctors and hospitals for the care provided. Everyone is covered, period. It's really just that simple. The core pillars of the program include coverage for all medically necessary health services with a free choice of doctor, dentist, nurse practitioner, or hospital. This will put an end to the means testing because everybody in the state is just covered. Medicaid, ACA, CHIP benefits, they're all included, and they have a predictable and stable funding for providers, so there's no more of this wondering when the next check is going to come in. Importantly, patients get to go where they want. In the Poor People's Campaign, we talk a lot about the ways that this country divides us. The New York Health Plan removes barriers for things like age, sex, income, wealth, employment, health status. There's no regressive insurance premiums, no payments at the time of service, no deductibles, and no co-pays. Am I in heaven yet? That's what it sounds like to me. The comprehensive benefits include primary and preventative care, inpatient, outpatient hospital care, prescription drugs, dental, vision, and hearing, long-term care, and free choice of providers. It's going to be funded through a progressive graduated payroll tax. 80% of it comes from the employers, 20% of it comes from the employees. At the end of the day, 98% of New Yorkers are going to pay less for their insurance. The funds that would normally come into the state for federal Medicare, Medicaid, CHIP, and ACA funds get rolled into this, so they're still going to get the same. Those folks will still have coverage, but the money is still also coming in to help fund the overall fund to pay for that. These charts show us how employees who have to pay their own health insurance premiums now will pay through New York Health instead. It removes their co-pays, their deductibles, and their out-of-pocket expenses, cutting their household spending on health care by 1/3. Who can argue with saving 1/3 of your health care budget? Come on, that's pretty awesome. For those that are on Medicare and they're worried about their benefits, I can certainly understand that. I'm one of them. I am on Medicare. But I can tell you that the New York Health Act is actually going to improve the benefit package with perennial concerns like vision, dental, hearing, and long-term expenses taken care of, and no more out-of-pocket concerns. Snowbirds are taken into consideration with the plan. There's no donut hole for the prescription drug coverage, and there's an improved provider network. For those on Medicaid, you'll also see that improved provider network. You're going to have access to specialists. You're not going to have out-of-pocket, and you get to keep the generous benefits package that you already have. And it ends the segmented coverage that we used to have, and it gets rid of means testing. I don't know how many of you guys have ever had to be through a Medicaid renewal cert. It's a pain in the butt, and it's really embarrassing, and that's a story for another day. But can we really do this? I mean, is this something that we could really do? So far. Yes, together we can win.
Yeah.
In the Poor People's Campaign, we constantly remind folks that the only way we're going to succeed is to move forward together and not one step back. Our movement is growing, and we need your help to fight for guaranteed health care for all. So we're going to join the Poor People's Campaign and the Campaign for New York Health. The opposition is very well funded, but our movement is steadily gaining our ground. This is some of the legislative history of this particular piece of legislation we're talking about and some of our wins. The insurance companies claim that the New York Health Act will be disruptive and cost jobs. The New York Health Act will make health access more seamless for patients because all doctors are going to be in-network. The bill is written to provide transition assistance for workers that are displaced from the insurance industry. So wherever they go for future work, they're going to have health insurance follow them. The Business Council claims that the New York Health Act is going to be too expensive for business owners because it's a new tax. Healthcare costs for businesses are already increasing every single year, and they're projected to continue doing that. The Business Council, interestingly, does not represent all New York businesses, although they like to pretend they do. In fact, the New York State Sustainable Business Council and the Northeast Organic Farmers Association of New York, each of which have over 1,000 members, are in support of the New York Health Act. As a general rule, physicians tend to be supportive. We talked about psychiatry. They're right up there at the very top of the list. Almost 75% of the psychiatrists in New York State are willing to sign on for this. Now that we know what we're up against, what can we do to make this happen? There are so many ways that we can do this. Are you a faith leader? Do you know faith leaders? Sign the petition. Get the petition signed. There's an actual address just for the faith leaders. Have a forum about New York Health Act that can impact your own community. Are you a doctor or a medical student? Do you know a doctor or a medical student? Sign the petition. Get the petition signed. Several of us have taken materials to our doctors during our appointments, and it has yielded some amazing results. Someone even got a signature while they were in the emergency room. That's awesome. Small, medium, and large businesses count. Freelancers and self-employed people count. Private practices and some of the social ventures and nonprofits count also. If you aren't one of them, my guess is you're a consumer. Think about your friends, families, and neighbors. Do they run businesses? Think about former and current colleagues. Think about your favorite diner, barber, coffee shop, farmer, pet store. We have almost 500 businesses statewide in support of the New York Health Act. Let's show even more of New York supporting the New York Health Act and how that would impact our businesses and our lives. Community, political, and grassroots organizations and unions can also endorse and send memos of support to our legislators. Endorsements, of course, is not how we're going to reach this victory, though. Yes, get the leaders in businesses and organizations to endorse the New York Health Act, but really, we want them to participate in the movement. It could be as simple as including something about New York Health in their email newsletter, or reaching out to their network of people to spread the word and discuss how guaranteed health care and the New York Health Act will impact them and their communities. Host a forum, having tables at fairs, organizing, canvassing, visiting with legislators, sharing social media or graphic design skills, using the New York Health Business Calculator. Again, there are so many ways to support this grassroots level movement. We want to hear from you and how you think you can fit in. We love hearing new ideas and ways to build this movement together. Of all of our methods, there is one major core element, though: our stories. As the Elmira Poor People's Campaign has already seen, it is absolutely a powerful thing when stories and connections start getting made and people come together to achieve guaranteed health care for everybody. Everybody has a health care story. Their testimonials are important for putting this current system on trial and shifting the narrative to prioritize people over profits, which also helps to bring a lens to every issue, whether it's housing, the environment, criminal justice, all of it. There are so many ways to collect stories and use them strategically. We have one great method to share with you right now. Individual testimonials. As we saw earlier, testimonials from doctors, businesses, nurses, community organizers, neighbors, co-workers, and of course, patients. Because everybody is a patient. Testimonials are used in letters to the editor, video, social media campaigns, public events, and more. We will be bringing our stories to our legislators with a healthcare hero action every week. For those interested in a more aggressive method of using their power, there is some civil disobedience. The New York Health Act Direct Action Group called Picket the Profiteers is a pretty neat organization. I've been learning a little bit about them. It's a coalition of groups and anyone can join. Currently, the main players are the Campaign for New York Health, Physicians for a National Health Program, ACT UP, and DSA Socialist Feminists. The first action happened just a couple of months ago where 4 people disrupted the New York Health Plan Association conference. The second action is in the process of being developed right now, and it will be in response to drug price increases, something we just heard about earlier. There will be some banner dropping, chanting, blocking entrances, and things that we're all pretty familiar with. So let's build a movement and pass New York Health together and guarantee the right to health care. Here are some of the links that you can use to take the survey or to tell your health care story. We can partner in the community and events just like today. There's also the direct action options available. As Reverend King taught us, of all the forms of inequality, injustice in health care is the most shocking and inhuman. How would it change your life if you had guaranteed health care? Please take a moment on your way out to fill one of the postcards that we have out there. We actually have a couple of different designs. You can even choose a message for your legislator on the front of them. We also have a selfie station back here for those of us who have Valentine's Day coming up tomorrow. Take a picture with your sweetie and send it to your legislator and tell them, have a heart, pass New York Health. Thank you all for joining us. We really appreciate it. Remember, we are a new and unsettling force with nothing to lose but our change.